Welcome back. As I continued talking with 3 first responders who are now working to build a mental health unit here in Shreveport, they shared this bit of data with me. Early last year, over one 20-day period, SPD encountered and transported almost 150 people to Oxnard LSU Health that needed emergency health care. That's an alarming number, especially when you consider that's just one of several hospitals where police are taking these severely ill patients. Do you think the general public really has a grasp of the extent of those numbers and the extent of the crisis we face?
I don't know how they could, because we didn't know.
Right.
You know, this
when
has been,
I
you know.
heard that I was like, oh my gosh.
Does it make it feel that this task is almost impossible?
I don't think impossible. I think
Challenging.
Challenging is a better word. Yes, it's a need. I think it's more of an. It lets you know that now it's more of a need, if that makes sense.
It's a clearly identified need.
Right.
Is there a timeline in place when we might see a mental health unit in Shreveport that's out helping people?
I think our goal was like toward the end of the summer. That way we have several more CIT classes so that we can kind of get most of our officers that are on the street trained. So I'm hoping by the end of the summer that we have something in place.
Do you all believe that the stigma associated with mental illness in our community is still playing a role in this crisis and why more people aren't aware of what's going on?
Absolutely. But nobody wants to speak out. There's a stigma that comes with saying, okay, I have a mental health diagnosis, or I have a drug addiction problem, or whatever. There's a stigma that goes along with it. So I think that prevents some people from asking for help and acknowledging and admitting that they have a medical condition, because that's what a mental health it's a medical condition that they need treatment for. It's no different than if you were to break your bone, or if you were to, have a car accident and need medical treatment for that. It's the same thing. It's just, with your mind.
And Amy, I understand too that taking care of the mental health and well-being of the officers and the paramedics on both departments is going to be a main focus as well.
Well, I think that that's always kind of been a stigma that, law enforcement and fire department were supposed to be super strong, and we don't talk about what it is that we see yet. Our officers are the ones that are going out there and seeing people shot daily. We're experiencing a critical low staffing. We're having to work additional manpower. So, you can't, not have the conversation about officer wellness, about, EMS wellness. And that's a challenge too, because there's always been that stigma. You have that blue family and we don't really talk about it, but the bottom line is we're all suffering as well. This is a community problem, so what the community experiences as a crisis, so do we. And oftentimes we tend to internalize that. It's like, all right, get back up, next call, next call. And we have to change that, so. The
reality is if we don't protect the mental well-being of our first responders, those people who we expect to protect us won't be able to do that job. Right.
And Amy said it well. You have to be able to respond yourself before you can help somebody else. And she said it well, that we have to be able to see it within our ranks, see it within our guys, our male and female firefighters and police officers, that making sure that we're good to go before we respond.
Almost 3 months ago, we produced a documentary called Breakdown that shined a new light on the mental health crisis here and the role the first responders play in responding to folks who are suffering from mental illness. Has that done anything to change the perspective in your departments and in the community when it comes to this crisis?
Oh, I think absolutely. It's, there's a shortage of people going into the profession in general, so we know there's a critical shortage just in first responders to begin with, but it highlights the emphasis that, our nation is struggling, our communities are struggling, individuals are struggling. We're just coming out of this pandemic, and so we see that there's a need to do things differently. We don't exactly always know how that's going to look, but I think having that awareness kind of brought to the forefront, it's helpful for us. It's helpful for the agencies to see, well, how do we determine what better practices? So you guys were very helpful in that. And not to mention, I think from that program, we've had a lot of agencies reach out to us to really want to be a part of that. So.
And also we've actually had company officers that want that knowledge, want that education, can't wait to get into that crisis intervention training. So that's the buy-in from the police department and the fire department, they actually want that training.
Do you think that film helped to break down some barriers in terms of communication from community partners as well as people in your own agencies and even your bosses?
I think it's definitely started conversations between all of us as to what each agency can do better, you know, what our challenges are going to be. But yeah, those conversations kind of come up frequently within all of our organizations because we know that there's a need out there. We're just trying to figure out what's the best practice, how do we change our policies and procedures, and how do we get the funding sources? I mean, I know for the police department, we're over 100 officers down. How do we get the funding source going forward to really develop a strong mental health team that's going to be able to go out there and do that? So I think you guys bringing that to the forefront has really kind of helped us in our overall goal, and that's the funding source on how do we make this work.
Well, and I think anytime that you shine a light on an issue that's, I mean, everybody knows it's there, but again, it's a mountain, and how do you start to even try to climb that mountain? So anytime that you can shine a light on it and educate people, the public, the officers, the administration, city, and the police and fire administration, I think that starts conversations. And anytime you have people willing to come to the table and sit down and talk about an issue and start trying to come up with resolutions, it's always beneficial.